why is our healthcare plan built around insurance? Because the reality is, one of the greatest lies we've ever been told is that the number of people insured is a metric for wellness. Insurance is a financial transaction, it's a financial instrument. It helps pay bills, but it doesn't really make you any healthier. So I started just going through the process and saying, okay, let me put together a basic model. What if we took insurance out of the loop? Just pretend insurance is illegal. We're not trying to make insurance illegal. It's a financial transaction, buy it if you want. And so I said, let's just do something on a means tested basis so that you pay what you can afford to pay for your health care. And I said, let's limit it. If you have Medicaid or Medicare or employer-based insurance, we don't want to mess with that. Let's just focus on what the ACA covers and what Obamacare covers. And so that's about 47 million people. So I said, okay, let's look at means testing. And it's not like the government doesn't guarantee loans for other things. They'll guarantee you loans for a house in some cases. They'll guarantee you loans for mobile homes in some cases. They'll guarantee loans for small businesses. They'll guarantee loans for student loans, obviously, to the tune of more than $1 trillion. But if you're sick and you don't have enough money, even if you have insurance, you don't have enough money for your deductible, you have to put it on your credit card at 19%, borrow from family, if they can afford it. Go get on GoFundMe, which is the biggest category in GoFundMe, which is crazy, or die, or stay sick. And I'm like, that's not right. So I said, okay, let me put together some parameters for a healthcare model that says, all right, if you are ACA eligible, instead of buying insurance, the government will loan you the money for your healthcare. But when you're sick, you don't have to pay any premiums, don't have to pay into it. And so I modeled this program, and I sent it to a really far-left economist, and I said, tell me if I'm an idiot, and would this, is this going to be more expensive and less expensive? And honestly, I expected it to be more expensive, but as it turns out, the insurance companies introduced so much cost and overhead that the savings were incredible. To the government, it would save $40 billion per year, and to consumers, it would save $45 billion a year. And I'm like, wait, something's got to be wrong here. Why? Well, the reality is, as part of the ACA right now, the way it's structured, because there's insurance companies, because they silo data, because they make things complicated generally, the cost of healthcare isn't the cost of healthcare. There's extra administrative costs and all that. So long story short, so I'm like, okay, we've got something here. So I started, connected with Mark. Mark introduced me to some really smart people and introduced me to different politicians, and I started presenting it to them. And I got a lot of great feedback. I talked to right-oriented think tanks, left-oriented think tanks, people who started the ACA, people who love the ACA, people who hate the ACA, and we've modified it into something called the 10 plan, which, as I said, the bottom line is if you make $30,000 or less, you never pay more than a $25 copay. If you make more than $30,000, you'll pay anywhere from 5% to 10% of your income, but only when you need health care. And so it's made its way up the ladder, and now the 10 plan is being evaluated through something called a 1332 waiver for the state of Illinois, because I met with Senator Durbin, and he said, if you can show me that we'll save money versus the ACA, I'll take a deep look at it. And for the state of Arizona, because the governor there said, I love the idea, I want to be the first, but you've got to put together the model that shows it. So that's where we're at, and it's made its way to the White House, and they've given me feedback, so there's a small chance, but when you hear the Republicans talking about a new healthcare alternative or complement, because this also works under the ACA, then hopefully they're going to be talking about the 10 plan. So, not what you asked to hear, but